Hi everyone. Today in this video let us discuss about Clobetasone ointment. What is this drug Clobetasone? The suffix "sone" indicates that this drug is one of the corticosteroid. This drug is available as its ester clobetasone butyrate. This is one of the topical corticosteroid indicated for inflammatory skin reactions. We have another drug with similar name which may be confusing, that is clobetasol. Here the suffix is "sol", again it indicates it is a corticosteroid. But this clobetasol is available as clobetasol propionate, and this is not equivalent to clobetasone. Clobetasone is a mild corticosteroid, whereas clobetasol propionate is a stronger corticosteroid that can have more suppressive effect on HP axis. That's why clobetasol propionate is available as a prescription drug, whereas clobetasone butyrate is a mild corticosteroid that is available as a cream or ointment over the counter. So clobetasone is a OTC drug, and this drug is having anti-inflammatory actions. That's why it can be used for inflammatory skin disorders. It is available as ointment as well as cream, and particularly this drug can be used to reduce inflammation on the skin. So it can be used in the treatment of eczema as well as for the treatment of any insect bites, rashes due to the dust mites, or nappy rash. In any of these conditions where allergic inflammatory response is increased, in such conditions clobetasone ointment can be given in order to reduce irritation, itching and redness of the skin. This drug topically can also be used for the treatment of psoriasis, and even it can be used for contact dermatitis. In all these conditions clobetasone butyrate can be used, and sometimes this drug can be combined with antifungal agents like nystatin, miconazole. With any of these antifungal agents it can be combined to produce anti-inflammatory as well as antifungal actions. So today in this video we are going to see how this drug acts, what are the important precautions, side effects, doses, all these points we will discuss in this video. First of all, let us see the precautions of this drug. Already we have discussed that clobetasone is available as ointment or cream, and this drug is a topical corticosteroid. So it should be applied on the skin which is intact, where inflammation persists. But at the same time this clobetasone should not be applied to the broken skin, because when this drug is applied to the broken skin, there may be a chance of skin irritation and increased risk of systemic absorption. When this drug is systemically absorbed, it can produce steroidal effects resulting in the various complications on the different organs. For instance, it can increase the glucose levels, it can reduce the growth in the children, it can increase the blood pressure. So any of these systemic side effects can be observed when this clobetasone is applied on broken skin, as well as it can also increase the local skin reactions. That's why this drug should not be applied on broken or cut skin. Instead, this drug should be applied on the intact skin, and here this ointment should be applied as a thin film in the direction of hair growth, and it should be kept in contact with the skin for at least 30 minutes before application of any other agent or moisturizer. So within these 30 minutes, it interacts with the skin where it can reduce the inflammatory response, and if anything is applied before these 30 minutes, it may interact with the absorption as well as actions of clobetasone. And if it is required, a bandage can be applied on the skin where ointment is applied, but at least 10 minutes gap should be there after application of the ointment. Even clobetasone is a mild agent, but it should not be used for long term. Since this drug is going to reduce the symptoms of inflammatory response, clobetasone should be used for less than or equal to 7 days. So more than 7 days use of clobetasone is not recommended. If symptoms still persist, it may indicate any other causes like bacterial or fungal infections. Similarly, this drug is not suitable in the people with acne, where this further increases the irritation and redness of the skin. Similarly, another important precaution is that this drug should not be applied directly to the face unless it is prescribed, except in the conditions like psoriasis where it can be applied on the face. But in other conditions, clobetasone is not intended for application on the face, because the facial skin is somewhat thin, and this drug can further reduce the thickness of the skin So thinning of the skin is one of the important limitation of clobetasone. That's why it should not be applied on the face, which may result in skin irritation, redness, and thinning of the skin. And if it is required to be applied on the face, then this ointment should be applied for less than 5 days in order to avoid thinning of the skin. Similarly, this drug should not be applied to the eye directly because it can produce irritation and eye discharge. Similarly, another important precaution is the use of this drug in the children with age less than 12 years. Generally, corticosteroids can affect the growth of the children. With long-term use of clobetasone, it can reduce the growth in the children. That's why this drug should not be used for long-term, particularly in the children with age less than 12 years. So it is recommended that in the children, clobetasone should be used for less than 7 days in order to avoid any adverse effects on growth in the children. Now let us see how this drug acts. Clobetasone is one of the glucocorticoid. It can act on the glucocorticoid receptors which are present within the cytoplasm. These glucocorticoid receptors are coupled with one of the protein HSP90, heat shock protein 90. The target of these receptors is the DNA within the nucleus. When clobetasone occupies the glucocorticoid receptors, they are going to be internalized, and within the nucleus they are going to be dimerized, and they can interact with the DNA to produce the gene transcription, and they can release the mRNA. This mRNA can code for few of the proteins which can undergo protein synthesis to release few of the proteins like lipocortin 1 and annexin A1. The interaction of glucocorticoid receptors with DNA can also inhibit the release of IL-2, interleukin 2, which can further reduce inflammatory response. Whenever there is an inflammatory stimuli, it can activate one of the proteins, phospholipase A2. This phospholipase A2 is a cleavage enzyme which can act on the phospholipids to produce one of the important metabolite, that is arachidonic acid. This arachidonic acid is a C20 fatty acid which can be converted into various mediators by another enzyme COX, cyclooxygenase. Now COX can act on the arachidonic acid to produce various types of mediators like thromboxane A2, PGE2 and PGI2. All these mediators can increase the vasodilation and inflammatory response, which can produce some irritation, itching and redness of the skin. All these conditions can be controlled by clobetasone, which is a corticosteroid. This clobetasone can activate annexin A1. This annexin A1 can inhibit the activity of phospholipase A2. In this way, it can reduce the inflammatory response. All these actions may result in anti-inflammatory effects of clobetasone. Now let us see the side effects of this drug. The side effects of clobetasone are mainly local reactions. It can produce some burning, stinging and skin irritation. On long-term use, this drug may produce various effects on the skin. Particularly, it can produce thinning of the skin, and it can also develop some stretch marks on the skin. That's why this drug should be used for less than 7 days in order to avoid long-term effects. Within the children with age less than 12 years, this drug can produce retardation of the growth on long-term use. These are the common side effects that can be observed with clobetasone. In case of any other side effects like swollen red skin, pus formation, it may indicate the development of any bacterial, viral or fungal infection. In such condition, clobetasone ointment alone is not useful, and it can further increase the infection by increasing the skin irritation and thinning of the skin. So, in presence of infection, clobetasone ointment alone is not useful. Now let us see the chemical nature of this drug. So this is the structure of clobetasone. Here we can observe the chlorine is attached at the terminal, so we have the prefix clo. And here methyl group is attached at the 16th position by beta configuration, so the infix beta. And it is having a ketone group at the 11th position, so it is having the suffix -one. So simply it is a clobetasone. And here 17th position OH group is present, which can be attached to a ester like butyrate. So then it forms clobetasone butyrate. How it is given? This drug is available as an ointment as well as cream at a strength of 0.05%. This cream should be applied as a thin film 2 times a day. But when it is applied 2 times a day, there should be at least 8 to 12 hours gap between the 2 applications in order to minimize the systemic absorption and local skin reactions. So that's all about this drug, clobetasone butyrate. This drug is somewhat similar to the another drug clobetasol propionate, which is somewhat more potent compared with clobetasone. This clobetasone is available as over-counter medication and it can be used for inflammatory skin disorders. So that's all about this drug, clobetasone. Hope you have enjoyed this video. If you like this video, please subscribe to our channel, share this video with your friends, post your comments in the comment box. Thank you for watching this video.